Go.
Good morning, Mrs. Jones. Today I'm going to be doing a soap suds enema. So I'm going to go ahead and get all my supplies ready, and I'm going to fill my bag 500 to 1,000 milliliters of 105 to 110 degree water. And I'm going to add my soap, and then I'm going to slightly agitate it, but not too much. Once I have my bag ready, I'm going to go ahead and hang it until I'm ready to use it. And then I'm going to help Mrs. Jones get to her sideline position. So I'm going to put her on her left side. So she'll go on her left side with her right knee flexed, and this helps with the flow of gravity. And then I will only expose what I need exposed, and I'll place a bed bath blanket for her comfort. And then also, before I start, this can be delegated to a NAP if they are trained and if the patient is stable enough for the nursing assistant to do so. So then I'm going to go ahead and grab my waterproof pad, and I would probably go ahead and grab a Chugs pad as well. That way that protects the bed as much as possible. And then I would grab a bedside commode or anything that the patient might need to use the restroom, so a bedpan, toilet paper, anything like that. And then I'm going to grab my bag, make sure that the clamp is closed. Then I would lubricate the tip, and I would insert into the rectum 3 to 4 inches, and asking the patient to take deep breaths as I push in and tell them that they're going to feel some pressure. And then I would go ahead and release the clamp, and if they started to feel pain, I would go ahead and slow the flow by lowering the bag. And if they still felt a ton of pain and it was really uncomfortable, I would go ahead and completely stop the procedure and call their primary care provider. If not, and they are okay, I would slowly raise the bag, allowing the enema to go in. And then once the enema is done, I would go ahead and clamp it and tell them that I'm going to remove their enema. And then I would go ahead and dispose of this. So this is going to be disposed. And then I would go ahead and wipe up the patient and ask them to retain the fluid for 5 to 15 minutes. Tell them that the bedpan is over there, the bedside commode, or ask them if they need anything. And then I would go ahead and remove this and place it in the yellow bag. And I would help them to their regular position and cover them back up. And again, tell them to try to retain it for 5 to 15 minutes. If they're unable to, go ahead and press call light if they need help using the restroom, and then make sure that the toilet paper and the bed and everything is lowered before leaving the room.